Cystic fibrosis is a genetic disease, so it affects your secretions that you produce in your body, and basically the defect is at the cellular level, and it causes the secretions in your lungs, in your pancreas, in your intestines, in your sinuses to be very thick. If you meet somebody with cystic fibrosis, you might not necessarily know that they're different. There are different presentations of the disease. So if you have, say, the whole gamut, and you have pulmonary issues, and you have pancreatic issues where you're not gaining the weight, then you have to be introduced to different nutrition substances. You have to take pills every time you eat, and plus you have to do chest physical therapy every day of your life from diagnosis on, to be able to clear secretions, and do a lot of blood testing, a lot of sputum, a lot of involvement with the medical teams, whereas a kid who's just born without this is only at the doctor's office for their regular checkups and their immunizations.
It was hard. I mean, I had to do therapy. I couldn't do it on my own. I actually had to have my parents or a therapist actually do physical therapy on me, so I couldn't have my own schedule, couldn't sleep over friends' houses. I had to take medicine daily. I mean, when I was a baby, I don't even know how they got the enzyme in me.
And years ago, before they discovered actually how to treat cystic fibrosis, most children would die in infancy from malnutrition. 36 years of age is the median survival for a patient with CF1 today. If the median age is 36, a lot of them may die in their 20s. A lot of them may die in their late teens. It depends on many factors. There's patients that no matter what they do to stay healthy, they still succumb to these pulmonary infections that they can't fight. Their lungs become very, very weak and tired and sick, and no matter what they do, no matter how many antibiotics and all that, they may not be able to make it through.
I mean, if I didn't have insurance, it would be.
Everything is expensive, co-pays. I hear from a lot of our patients that even though they have insurance, these medications that they use to treat this disease are super expensive. Just one mucus thinner that's used that came out in 1993, Homozymes, is about $1,000 a month.
$1,000 a package
for one vial a day,
which is one of the inhalers I take through a nebulizer. So
if your insurance covers it, you may still have co-pays of $50 or $60 per medication.
Oh, this is my enzyme. I have to take it every time I eat, with every meal. Also with snacks. Basically any time I need to digest something, I have to take this.
The pancreatic enzymes are not super expensive, but you may have a copay for that for $25, and you may use, depending on how many enzymes you take a month, you may use 4 bottles or 5 bottles, so it adds up.
I take 6 with each meal. Actually, it depends on how much I eat. If I eat a lot, I'll take 7. If I take a small little meal, I'll take 5. But even if I have a yogurt or anything that has fat in it, I have to take it. So even a little snack, I take 1 or 2. This is my vitamin that I have to take a day. It's a special vitamin. It's called Adex. Because, I don't make the normal vitamins that I need. This is an antibiotic. I have a little cold, so, I gotta be on something to make sure I don't get sick or sicker, to make sure an infection doesn't get in my lungs.
Aerosolized antibiotics, the Toby, which is out there now for this Pseudomonas treatments, is almost $2,000 a month to use that drug. And so between that and your Pulmozyme, you're already up to $3,000. So the medical insurance also has caps.
I would say the most important medication is the enzyme. If I stopped taking that, I couldn't eat. I could eat, but I'd be in pain. I couldn't digest my food. Wouldn't get nutrients. I'd probably be really out of breath all the time. Probably get sick real easy. I wouldn't be doing as well if I didn't take the medications. So
they would die. Without the treatment, you just get worse and worse. The only cure that they have for CF right now, which I would call a cure, is a lung transplant. So you don't need to do therapy anymore. Your lungs work. You can breathe. You don't have to worry about infections. Your other cells in your bodies, you know, in your pancreas and in your intestine and in your kidney may still have the defect there, but it would not be lethal.
You treat the disease for as long as you want, but eventually it's going to take control. That's why it's called the disease. It's not supposed to be there. So we need to fix things, not just keep pushing it aside. And
treat the disease and not exactly cure it, you know, just make it more of a chronic illness.
Keep inventing more medicines.
That cure involves taking a lot of immunosuppressive medications.
More medicines.
And being still very followed through the community of physicians.
More medicines.
You still would have to take your enzymes and stuff, but that would be, everyone would love to be able to do just that.
It's just a money market to me.
Medications that you can put into the airway to correct the imbalance in the fluid, to thin it out.
Again, it's just a money market to me. Just keep getting the medicines out there to help people, but not to fix them.
So the cure, in other words, would just be to be able to continue to treat the disease on a lower level.
Yeah. I mean, if you don't have to do therapy, if you have good lung function and your lungs are normal, I think that's the cure we all hope. That would be cure enough for me.
Right.
Or for any CF patient, you know. I take care of cystic fibrosis patients from birth through adulthood, basically.
I mean, I've seen on TV a lot that they've implemented stem cell research in monkeys and mice, and that they actually develop beating hearts and all kinds of different just amazing things. If you could help implement it to people, why not? You could also get the stem cells from umbilical cords. I mean, after you're born, I'm sure they cut the umbilical cord, they take care of their baby, and they throw the umbilical cord away. What else can you do with it? You can't eat it, so use it. Get those stem cells, do some research. Stem cells is just fixing things that aren't supposed to be wrong with us. There's nothing wrong with that. Unethical religiously, I don't get how it's unethical. What if they were put in other people's shoes? I'm sure it would be ethical enough. It's unethical to cure people, to make their lives better. I don't see how that's... I think it's funny. That's just stupid. Why make people suffer when they don't have to? That's what being a doctor is all about. And
I think it's fine. Definitely.
As long as it could help.
Yeah.
It's not just cystic fibrosis. It's not just what I have. The thing about stem cell research is it's applicable to everything, to every disease, genetic disorder, everything you could think of. So, I mean, why not put more money into it and develop it so we can things that are wrong with us today. I'm a normal guy, but I have a disease, so it's the only difference.